Welcome, everyone. Thank you for joining us. I know folks are going to continue to come in as we get started here, but I'm thrilled to be with you all today. I'm Beth Griffiths, and along with Janet Kaufman, we share the role of co-associate directors for policy programs at the Institute for Health Policy Studies. And we're thrilled to bring back our Institute for Health Policy Studies, or IHPS, an impact program collaboration on the Impacting Policy series. This year, our focus will really be highlighting topics that feel especially salient in these times. And to kick us off, we're very honored to have Ami Alden from UCSF Community and Government Relations joining us today. I'll introduce her more in a moment, but just want to welcome everyone and make sure people are aware that you can put your questions in the chat. Please feel free to do that as we go. And we'll have a couple of breakpoints where Ami will answer your questions, and then we'll have time at the end as well. In addition, we want to make sure you're aware that our series will continue with these monthly Wednesday webinars. We will be hearing from Lauren Lempert in October on how to comment on regulations, and from Scott Ogus from the Senate Budget Committee in November on the state budget process, since we know that those are some really salient topics right now. And then we'll be back again in January. Also want to highlight on October 23rd in the morning, if you want to go a little bit deeper with us, that we have interactive workshops. In the fall, we do how to work with journalists, and in the spring, along with Ami, we do how to meet with policymakers. And so we will continue to have those opportunities. The fall October workshop is October 23rd, and is currently open to IHPS affiliates and will open to our broader UCSF community shortly. So definitely feel free to reach out to us if you'd like to get involved. Those usually do fill up, so we recommend you go ahead and sign up. But without further ado, let me turn to introducing Ami. I'm really grateful to have her joining us today to really talk again about the importance of impacting the policy process, how to do that, and then also specifically how to do that with UCSF government relations, and in the context of being a UCSF employee, since we know people have had questions about that right in these times. So let me go ahead and introduce Ami. Ami is UCSF's Director of Local and State Government Relations, and she's been just an amazing partner to IHPS in recent years. She supports UCSF's mission and work to improve health policy by connecting UCSF leaders, faculty, and staff with the San Francisco Board of Supervisors, the mayor's office, the state legislature, and the governor's office, as well as local and state agencies. She's responsible for planning and implementing the university's local and state government relations and advocacy efforts in San Francisco and Sacramento. And before coming to UCSF, Ami worked for State Assembly Budget Chair Phil Ting and for then Mayor Gavin Newsom. Ami holds a master's of public policy from UC Berkeley and a BA from Georgetown. She's originally from Santa Barbara and today lives in San Francisco with her husband and two children. So I'll turn it over to Ami. Thank you so much.
Great. Dr. Griffiths and Dr. Kaufman, thank you so much for having me. And thanks for everyone who jumped on this call. It's really a pleasure to be here. And I am so grateful for IHPS and all that you do to bring this knowledge to the community. So let me go ahead and get started. I'm going to share my slides with all of you, and I'm going to pause along the way to answer questions that folks might have. So, or also just feel free to put those in the chat. Okay. So we call this presentation Advocacy 101, Advocate for Science at UCSF and beyond. And I love starting with this picture. These are students from the UCSF School of Medicine meeting with a member of the state legislature to request more funding for the PRIME program, which many of you may know is a program that recruits students who specifically want to practice medicine in underserved communities. It's funded in part by a direct state appropriation, and as we are trying to expand that program, we went to meet with legislators, and of course, there's no better spokespeople for the university than all of you. I have a great job at UCSF. I think I have the best job. I'm basically the in-house advocate on the government level for UC and for our mission. But my job is to really coordinate the advocacy, and the best advocates are all of you. because that's who legislators and policymakers want to hear from. And so that's what we're going to talk about today, is about how to do that. First thing we want to start with is the why. With any advocacy or any persuasive argument, you want to say, why are we here? What is this about? And so this presentation also starts with that. Why advocate for science? None of you came to UCSF to be lobbyists. When you went through your training in medical school or in your graduate and PhD programs or postdoc programs, you were not there to learn how to be government advocates. So why does this matter? So here's an example. This is a member of Congress, and he is holding a snowball on the floor of the US Senate. And he says climate change is the greatest hoax ever perpetrated on the American people. We keep hearing that this has been the warmest year on record. And I asked the chair, do you know what this is? It's a snowball. And that's from just outside here. So it's very, very cold out. Senator James Inhofe, Republican from Oklahoma, a large fossil fuel producing state, explaining that climate change is not real because he can get an intern to scrape a snowball off the steps of the Capitol and bring it in before it melts. Kind of hilarious. The next example is not as funny. Here's a member of Congress, Republican from Missouri, Todd Akin, saying, from what I understand from doctors, it's really rare. If it's a legitimate rape, whatever that means, the female body has ways to try to shut the whole thing down. So this is a federal lawmaker explaining why rape victims can't get pregnant because somehow the female body knows that the sex is not consensual and somehow magically prohibits conception. When that statement came out, happily he was defeated in his run for the US Senate by a woman, Claire McCaskill. But this is the kind of thinking that some policymakers have. And given the recent news that we've all been following, no one should be surprised that there is, at a minimum, ignorance of and sometimes pure hostility to science among some policymakers, but not all. Here is Speaker Emerita and San Francisco Member of Congress Nancy Pelosi is speaking right here in Genentech Hall at Mission Bay. She says, as scientists, the most compelling argument is yours because you know that of which you speak. You are essential. Your contributions give us hope. Know your power. Know your responsibility. And who she's speaking to in that quote is every single person on this call. It's not just, well, talking to your lawmakers is kind of a nice thing to do if you're kind of into it. It's no, you're essential and your voice is powerful, and you actually have a responsibility to speak up and share what we know about science. Because when we don't, we allow the uninformed voices to be the ones who are making policy, and that's to the detriment of our research and our patients and the medical education that we provide here at UCSF. So, what is UCSF's role? And let me point out Dr. Joanne Spetz, our director at IHPS. She is talking to the really tall guy on the right, State Senator Josh Becker, who represents the peninsula at a IHPS forum in the state capitol. What do we do at UCSF? What role do we have on this? Well, one, we inform lawmakers what is happening, what are issues that we think they ought to care about, or when they tell us what they care about, what's the UCSF research that could actually inform the policymaking that they have. Educate these lawmakers, why does this matter? Influence them, what do we think should be done? And when we do that, we elevate UCSF's reputation as a trusted, nonpartisan, evidence-based resource for policymakers. One of the ways that IHPS does that is every year they go to Sacramento, they do a health policy symposium. They bring 4 faculty members, some of whom may be on this call, who give short TED-style talks on health policy topics that we think the legislature is going to be interested in. So last year we talked about AI in healthcare. We talked about behavioral health. We talked about abortion access and a variety of other topics that we knew were pending in the legislature. And we made UCSF experts available as a resource on those bills. Several lawmakers working on those topics followed up with us and ended up connecting with our faculty and got their input to make sure that the policy that they were making was actually informed by our evidence and our research. And that's exactly what UCSF should be doing. We support that kind of work through UCSF's Office of Community and Government Relations that's led by our Vice Chancellor, Dan Bernal. He reports up directly to Chancellor Hallgood. Our office is basically divided into three buckets. There's government relations, which is my world. We do local, state, and federal policy and advocacy. Our community relations world works on connecting with neighborhood organizations, sponsoring events, and producing events to help the community understand our work better. And then our anchor institution mission is about leveraging the economic might of this large university to make sure that we are wherever we can using local businesses and local residents for procurements and contracting and local hire. My talk is focused on the government part of this bucket, but we are a resource to the whole university, all of our faculty, our staff, our learners, to try to advance our mission to this external facing audience. So a couple things that we can do, how can our office sort of assist and promote the work that you are doing? So campus events and tours. Last week, we had the president of the Board of Supervisors, Raphael Mandelman, on campus, giving him a tour and meeting with leadership, meeting with the chancellor or with faculty members or leaders at the hospital. We can help produce social media posts that amplify the work that you're doing. So, of course, folks recognize the gentleman in the middle, Governor Gavin Newsom. On his left is Dr. Bree Williams, who leads the AMEND program, which is about improving healthcare in our state prison system, including San Quentin, just across the bay in Marin. The governor came to learn more about UCSF AMEND's program's work at San Quentin, and it was a way for us to amplify her work to a larger audience. Also, maybe you are doing work that you think would be good for amplifying, not just in social media, but maybe in the wider press. And you're not quite sure, how do I do that? We can help connect you to UCSF's Office of Communications, and they can discuss with you placement of a story, maybe in the San Francisco Chronicle or the New York Times, or a leading medical journal about the work that you're doing. In addition, we can also support and promote your work through bringing you to hearings on legislation that are in an area where maybe you have subject matter expertise. We can help you advocate for issues that are important to you. We can help get you placed at community events where you can spread your knowledge in the community. And this is a picture of UCSF's Black Health Initiative at the Bayview Sunday Streets. Dr. Malcolm John there in the middle leads that program. So in general, a couple things about if you want to, connect with elected officials or policymakers. One, we ask that you connect with my office, Community and Government Relations, before either meeting with an elected official or their staff in City Hall or the state capitol or in Congress, if you're there on UCSF business, or if you would like to invite elected officials to a UCSF event, whether it's on campus or off campus. We have a new mayor in San Francisco. We have many new members of the Board of Supervisors. Our faculty and our learners are very engaged in public life in San Francisco. A lot of people like to invite the mayor to events, for example. And what will sometimes end up happening is that I will end up getting a call from the mayor's scheduler. And she'll say, Ami, I have 5 different invitations from UCSF. Which one's the priority? Mayor Lurie can't do all 5. And I'll say, of course, the chancellor's invitation is the priority. Let me know who else has been sending invitations. I'll follow up with them, and maybe we can find a different public official that's a better fit for that event. So that's one of the ways that I can support you while maintaining our good relationships with elected officials. Sometimes our faculty, our learners, our staff will have a public policy idea. They'll realize through their research that if we could just change this regulation or have a bill or a budget ask, we can improve our clinical care, our research, or our ability to provide medical education. So you can reach out to my office, CGR, Community and Government Relations, anytime. I can help you think through this issue the way that an elected official would. What's the policy problem that you are trying to solve? And what are your recommendations for getting that done? And we'll talk a little bit more about that process in this presentation. I'll help you figure out, has UC Office of the President already taken action on this? Do they have a position? And if so, what would it be? I can help you come up with materials that we would share with elected officials to help engage them. And if we decide that this is actually something that we could do meetings on, I can help you actually schedule those meetings with the right people. I can help you figure out what level of government should actually take action on this issue. So, for example, is this a local issue? That's City Hall at the top. A state issue, there's a state capitol, and of course, folks recognize Congress at the bottom. Is this something that a state agency should maybe handle? Is this just a matter of a phone call to the California Department of Public Health? Or do we actually need to pass legislation? And do we need to talk to elected officials about that? Who are your allies on this issue? Are there nonprofit partners that could help? So, for example, if this is an issue about reproductive health, could we engage Planned Parenthood? Should we get the Bixby Center at UCSF involved? And who might oppose this? And how can we overcome that? What's the process that's used by these decision makers to get something done? Are there deadlines? And then again, does the University of California Office of the President, are they already involved in this? And do we need to engage them? We work with full range of elected officials across all levels of government. My specialty is local and state, so we work regularly with Mayor Daniel Lurie and with his staff, 11 members of the Board of Supervisors. I mentioned Supervisor Mandelman was on campus last week. We are going to have Supervisor Dorsey coming to a conference at UCSF in 2 weeks, and Supervisor Mandelman again in the new year. Mayor Lurie has been on campus a couple times already, so we are regularly engaging and building relationships with these folks. It benefits you because when I reach out and say, hey, could we get a meeting with you? A member of our faculty would like to share their research on a topic that we know you care about. CGR can make sure that we get that call returned and can help set up some time for you. We, of course, work regularly with state legislators. In this photo, the very two tall gentlemen that you may recognize on the far left are Vice Chancellor for Research Hal Collard and State Senator Scott Wiener. And then next to me, Dr. Ariane Tirani, who leads the UC Center for Climate, Health, and Equity. The Lieutenant Governor, Eleni Kounalakis, lives here in San Francisco. You may know she's also a UC Regent, and so very engaged in University of California issues. And not only do we engage with San Francisco legislators, as you all know, Benioff Children's Hospital Oakland is part of UCSF, and that gives us good relationships with our East Bay legislators. UCSF has affiliates all over the Bay Area and Northern California, and that helps us work closely with legislators who represent all of those areas. So, a couple of things about going to talk to elected officials. I love this picture. These are students from the UCSF Schools of Pharmacy and Dentistry meeting with staff in the state legislature. This is the way elected officials think. They have not been to medical school. Most of them are not postdocs. They do not want to read your 30-page research paper. Here's what they want to know. And here's actually, let's finish a few more things you should know about them. They're not scientists. Most legislators come out of the nonprofit world, the business world. They were teachers, they were staff, they were educators, they were active in labor, they owned a small business. There are currently in the 120-member state legislature, 3 members that went to medical school. There's a couple MSWs, but the vast majority have no clinical training. These are very busy people with limited time. They have a lot of competing priorities. They've got 10 meetings before yours and another 3 after yours. So a lot of things that they are juggling. So knowing how to explain what you want to get across to them briefly, succinctly, and in a meaningful way that they're going to remember is the way that you are going to be most effective with them. And that is what my office helps to prepare you to do. So here's how they think. Number one thing, why are you here? And can you define what is the problem that you are trying to solve? This is 2 years of public policy school boiled down to one sentence. What's the problem we're trying to solve here? So for example, what's the problem? Well, we have identified a novel coronavirus in Wuhan, China. So what? Why should anyone care about a virus halfway across the world? Well, it's highly contagious and it's airborne. So it has likelihood to spread all the way around the world and it's lethal. This is likely to kill millions of people and sicken and hospitalize many, many more. Wow. Now you've got my attention. Well, what do you want this policymaker to do about it? Well, we at UCSF, consulting with lots of health experts, have recommendations about developing a vaccine. And in the meantime, masking, social distancing, additional measures to keep the public safe. And why are these the best solutions? Well, are they most supported by evidence-based research at UCSF? Yes, they are. Is it the cheapest? Is it the most cost-effective? Can we get this done before the next election? Because I'm up for re-election in November. And can we get enough votes to actually pass something if we need to pass an ordinance? This one is key. Some things public health departments can do on their own. And as in COVID, many things were just implemented because DPH, the Department of Public Health at either the local or state level, has the power to do that. But for some other things that we want to accomplish, we actually need either the Board of Supervisors or the state legislature or Congress to vote. And you can have the best idea in the world, but if you don't have enough votes, it's not going to pass. So the Board of Supervisors in San Francisco, for example, has 11 members. And so think to yourself, we're going to do a little math problem in your head. What would a simple majority of 11 be in order to get a majority of 11? And after thinking in your head, hopefully you came up with the number 6. You need to get 6 votes to pass something. And if you have a really, really great idea, but you can only get 5 votes for it, then the work comes, how can you modify that idea? How can you change it? How can you tweak it so that you can get a 6th person on board? It may not be perfect, but it's what you can get right now in order to get to the 6 votes. Maybe next year you'll come back and you can do some additional work to get a little more of that loaf of bread. What do you want the elected official to actually do? Elected officials are action oriented. You never ever want to walk into an elected official's office and say, let me share my research with you. I'm super excited about it. The elected official will listen to you and say, congratulations, doctor. That is amazing research. What can I do to support you? Better have an answer. Really, really awkward to say, oh, I just wanted you to know about my research. Because if that's the answer, the elected official is going to think, this person just wasted my time. There's nothing for me to do here. That's 30 minutes of my life I'm never going to get back, and I'm annoyed. So it's good to walk in with, here's something actionable that you can do. For example, please support Assembly Bill 1234, or please amend that bill to exempt UC medical centers. We already do what that bill requires. Please support $1.8 million in the state budget to expand the Prime program to dental students. Please appoint Dr. Mark Leary to the Housing Conservatorship Advisory Board. Please call the California Department of Public Health and ask them to expedite their inspection of the Pritzker building so that we can start to see patients there. Please join us for a tour of Zuckerberg San Francisco General Hospital. Please attend our annual gala and give the keynote address. Everything that I've bolded is an action that we are asking elected officials to take. And in the picture, these are students meeting with Assemblymember Jim Wood about that third bullet, asking for his support for funding to expand the program Prime to dental students. Assemblymember Wood was himself a dentist who served in the state legislature until he termed out last year. My job at CGR is to know that, get you guys the meeting with the right person. Another thing that elected officials will ask you, can you bring me something in writing? So don't worry about reading the text of this one pager. I just want you to note certain things about how it's laid out. I'll just let you know the text has a clear ask and a clear definition of a problem and a summary of the relevant things an elected official needs to know. There's no jargon, there's no acronyms that elected officials won't understand. And here's the key thing. This document is broken up into blocks of text with headings and with bullets. The way that elected officials and their staff read documents is to scan it quickly. No one in the Capitol or City Hall has time to sit down with a good cup of coffee and take time to read a long paper. They just don't. They need something they can absorb in 1 minute because then they're off to the next thing. So making your document scannable, lots of white space, makes it much easier for them to absorb what you want them to know. Proofread, proofread, proofread. I love doing this bullet live because then I read it and I ask people to find the typos. The bold sentence says, we're very excited that Governor Newsom has signed the bill on public health. And when we're in person, I ask people to raise their hand, how many typos can you find if you read that sentence? Most people can find 1. Perhaps you can find 2. If you're really good, you can find 3. Some people can even find 4. And I'll go through them really quick. Hopefully you have found this one. This word is not excited. It's exited. Will spell check catch this? No. Governor Newsom, Newsom is misspelled with an E all the time. Why does that matter? Well, if you're going in to meet with Governor Newsom's staff and you hand them a document that misspells his name, you're done. The meeting's over. They'll think if you are not careful enough to look up how to spell the guy's name, what else are you not careful about? Can we really count on your research? Can we trust that you've done a careful job even preparing this information for us? And people are just offended. That's the thing they're going to remember about the meeting. So proofread names. The governor, did he sign the bill or did he singe the bill? Is spell check going to catch that? It's not. And then, of course, this is my favorite. He singed the bill on, we're trying to say public health. Uh, that's not what it says. I have seen all four of these mistakes made in documents that were drafted for public officials. It's really important that you proofread stuff carefully because if not, you lose all credibility and people are not going to have much to listen to about all the hard work that you've done on your science. Be sure that you have who's your organization, a little bit about them, and your letterhead. It's so hard to boil stuff down to this little space. But this is all that policymakers have time to read. So boil it down to the essentials and trust if they want to know more, they'll ask. So be sure they know how to find you. Your name, title, contact information at the bottom. So when they want to know more, they can send you a quick email. Here's some things that my office can also help prepare you for. If we set up a meeting for you with a policymaker, we can provide the background on who they are. For example, what's their role? This is State Senator Melissa Hurtado, former state senator who represented the Fresno area. Who are their constituents? Well, it's everyone who works at UCSF Fresno and the surrounding communities. What committees do they sit on? What committees do they oversee? She's a former member of the Higher Education Committee, which was great. We went to talk to her about funding for the Prime program. When is she up for reelection? And what legislation or other actions has she taken on an issue in the past? Do your homework before you meet with somebody. If they have already introduced a bill or given a speech or done a press conference on the issue that you're there to meet about, you want to note that right at the top. If you can start a meeting by thanking them, Senator Hurtado, we really want to thank you for the support you've provided to University of California in the past, particularly for the Prime program. We're here to meet with you today about continuing that in the next legislative cycle. Starting with a thank you is a great way to get yourself off onto good footing with a member. Not acknowledging the work that you've already done or the work that they have already done on your issue is a way to get yourself off on the wrong foot. And my office can help you with that kind of preparation. I love this picture. Students from medicine, dentistry, and pharmacy in the state capitol last year doing exactly that, meeting with Senator Scott Wiener on issues that we cared about for health education. Another thing that my office can do is prepare faculty in particular, but also students and staff and other experts to participate in legislative hearings. Here's the Chief of Emergency Medicine at Parnassus, Dr. Maria Raven. I helped her to participate in a hearing at the Board of Supervisors on behavioral health issues and how those present in emergency rooms across the city. So what faculty do is what they do best. They provide testimony on their expertise. What I do is I help them develop their presentation so that it is the most meaningful at a high level for policy experts. It's a different kind of presentation than what you would give at an academic conference. It's short at the 30,000-foot level, no jargon, and boiled down to key things that legislators can actually have an influence on. I coordinate all the logistics with the legislators calling the hearing. I schedule a prep meeting so everyone knows where to go, what to do, who are the other speakers, how long do I have to speak, all of that. And then I go with you to the hearing. I make sure you know where to stand. And then if the policymaker, the legislator, the supervisor asks a question that has nothing to do with what you're there to talk about, I can step up to the podium and say, Supervisor, that's a great question. Either here's the answer, or I'll do some work to get you an answer by the end of the day. It's more common than you might think. You're there to talk about subject X, but the legislator says, oh, look, UCSF is in the room. I want to ask them about subject Q. And I can help make sure that you're not put on the spot to answer something that's not necessarily your expertise. Now, UCSF is not the only organization that's doing advocacy your professional organization is oftentimes doing advocacy on issues that you care about. I put in four of the common ones for nursing, dentistry, medicine, and pharmacy, but there are any number of other professional organizations that you might be part of. Many of them schedule lobby days in Sacramento or Washington, D.C. You get on their newsletter and you can have an opportunity to travel with them to those places and advocate on behalf of your association for the bills that they care about. It's a way to multiply voices and say, I'm not just here on behalf of myself, but I'm here on behalf of CMA, talking about one of their policy priorities. It's also okay to say, I'm a faculty member, I'm a researcher, I'm an adjunct professor, I'm a postdoc at UCSF, but today I'm representing California Medical Association. Legislators and their staff are very used to smart people like all of you wearing multiple different hats. It's not confusing to them. Just be sure you're clear who you're representing. Another way to get your voice heard in front of policymakers, that's a very low barrier to entry. Town halls. If you can get yourself on the mailing list, just sign up online for your local member of the Board of Supervisors or state elected official or your member of Congress. All of them come back to the district and do town halls once or twice a year. You show up, the legislator speaks, and then they set up a mic. Anyone can walk up and ask a question. You take your turn, you are polite and respectful. Bring some friends with you and have them also ask questions and sort of, again, multiply your voices. But here's the key thing. Don't just ask your question. Figure out who the staffers are for that member who are in the room. Usually the legislator will say, I'd like to thank my staff. Could they all raise their hands, please? And he'll point them out around the room. Pay attention and go up to them afterwards. Hand them your business card. Hi, I'm Amy Alden. I'm the one that asked you about the drug discounts and would love to follow up with you and have a meeting. Could I get your card? And I'll send you an email to request a meeting. So, what if you would like to do advocacy, but arranging everything on your own and trying to put together a one-pager and schedule meetings sounds like a little bit much. And you're wondering, is there anything that UCSF is already working on and you can just help out? And the answer is yes. We have a program called UCSF Advocates, and we work on issues like, again, expanding Prime to the School of Dentistry, protecting abortion access in California, protecting the UC budget from cuts proposed by the governor the last couple of years, protecting funding for the National Institutes of Health, probably number one issue this year, creating a California version of NIH in case federal funding does not come through. These are all topics that we encourage and invite members of UCSF, faculty, staff, students, alumni to get involved in. And here's how it works. You can right now pull out your phone and scan the QR code on this page, or you can send an email to advocacy@ucsf.edu, and we'll ask you to sign up. We ask for your name and your email and your address. And the reason that we ask for your address is so that we can look up for you who is your elected member of the San Francisco Board of Supervisors, who is your state assembly member, who is your member of Congress. It's all based on where you live. We don't sell or share that information with anybody. It's purely so we can send your advocacy to the right person. A couple times a month, once or twice, you will get an email from us inviting you to participate in a campaign. And it will say, Dear Dr. Griffiths, would you like to advocate to your member of Congress to save funding for the NIH? If so, click here. You click a button. We have pre-written a letter or an email for you that you have the ability to go in and edit as you wish. And then you click send, and we send it for you on your behalf to your legislator. So it's literally a couple clicks of a button that makes it very easy for you to advocate for the right elected official. And the letter will say, dear member of, dear Congresswoman Speaker Emerita Nancy Pelosi, my name is Amy Alden. I'm a staff member at UCSF, and I urge you to preserve funding for NIH. Here's all the reasons it's important to UCSF. Here's what my research is about and how I've been affected by the cuts. Thank you for all you can do to preserve this funding. My name, my address, and it goes right to her office. It's such an easy way to participate, and I encourage you to not only sign up, but encourage your colleagues at the university to sign up as well. Final tool I want to throw out here, the op-ed. You could take an entire day-long course on this. I'm going to give it one slide. What this is an opportunity for you to write an opinion piece where you tell your unique story based on your expertise in a particular issue. You state relevant facts about this issue and you make a clear ask. There's a bill pending in the state legislature. For example, in the picture to the right, there's state legislation pending to make the abortion pill, mifepristone, available to university students across California. You either support that or you oppose it. You don't use scientific or medical jargon that the general public won't understand, and you make clear who you represent. This is an actual op-ed that was written by Dr. Dan Grossman on our OBGYN faculty in support of legislation pending in the state legislature. And he wrote this on his own behalf, not on behalf of the university. UC actually didn't take a position on this bill. But he obviously is, as an OBGYN, has expertise in this issue, and we helped him get this published in the San Francisco Chronicle. So that's something that my office can help make connections for you. And then members of the legislature or other policymakers read that op-ed and say, wow, Dr. Dan Grossman, I'd love to invite that guy to come testify at a hearing. And then I get the phone call from that legislator saying, hey, Ami, did you see that op-ed by your faculty member? Could we get that guy to come testify at our hearing on the bill? So it's a great way to kind of get yourself out there and get your issue out there. This is a way of also influencing legislation, even if you are not participating on behalf of University of California. If, as in the example that I just provided, UC has not endorsed a bill, you can still participate by providing expert witness testimony in your role as a faculty expert. So right now in the legislature, a bill is pending that would require pharmacies to stop selling tobacco products in that pharmacy. The bill's being led by the Campaign for Tobacco-Free Kids, not by University of California. UC has not taken a position on the bill only because it's not about UC. We've got other priorities that we're focused on. But Campaign for Tobacco-Free Kids reached out to Dr. Lisa Kroon, one of our senior pharmacy leaders, and said, can you come up to Sacramento and testify in your position as a clinical expert on tobacco use and talk about, and as a pharmacist, and talk about why it's important to take tobacco products out of pharmacies. Dr. Kroon said, yes, absolutely. I helped prepare her for the hearing. She went up, she spoke, and the credibility that she brings to the table, just saying, I'm here on behalf of UCSF, is massive, and she helped advance that bill, even though University of California is not formally involved. So, before I talk about a couple key issues that we are involved in this year, let me pause and ask if there's any questions in the chat or questions that folks would like to raise now about sort of how all this process works and what's okay to do and what's not okay to do. Questions I can answer at this point.
So I'll just reiterate, please put your questions in the chat if you would, if you have any questions, and maybe I'll ask a question while give folks just a bit of time to do that. So one question I have is, obviously, many of us are engaged in many things at UCSF, and your office can't take on all of them. So how do you figure out what to prioritize at the UCSF and UC level? And is there anything we can do to help get our issue to the top of the list?
Yeah, absolutely. That is such a great question. Um, the information flows both ways. Sometimes faculty raise an issue to me that they say, I mean, this is really a priority, not only to me, but to all of the researchers that I work with across University of California. I think this is something that the legislature should work on or that the mayor should know about. Do you think you could help me elevate this? My calculus becomes, is this something that, given my knowledge of the legislature or the governor or the board of supervisors, is this something that I think they would find compelling? And do I think there's a legislator who would want to work on that? Or do I think I could find somebody who would? And I'm very generous about that. I'm always happy to see if I can figure out. And then I'll be realistic with you about whether I think politically that issue is going to get traction this year. I'm happy to help present it, but can help you have a picture of, yes, that's a hot issue. This is about protecting reproductive health in this environment 100%. Let's move this forward. Or, this is an issue that politically has had some challenges in the past. And yes, it's important that we provide regulations for artificial intelligence in healthcare, and there are bills moving on that already. But here's the challenges they've had. Let's think about whether what you want to accomplish is going to be a good fit. And then sometimes the information flows the other way. Legislators reach out to me and say, Ami, I'm running a bill on a certain topic. I'm running a bill on making sure that hospitals like UCSF can still maintain access to the 340B drug discount program. Do you have faculty who have expertise in how we do pharmacy billing? And I'll say, yes, I do. Let me find you the right person. So, having a conversation with me is a great way for me to help figure out whether your bill is going to be a good one to position via UCSF. Or I might say, you know what, UC is not going to take on that issue this year, but let's talk through some other advocacy organizations that might. Maybe this is actually a better issue for the California Hospital Association or the California Children's Hospital Association, or actually, you know what, Campaign for Tobacco-Free Kids. Why don't you present it to them or to the American Cancer Society? And let's get you connected. And that's probably a better route.
Perfect. Yeah, I think oftentimes it's super helpful for people to hear that even if UC doesn't have an official position, there's still ways in which it can be really helpful to talk with you and coordinate with you and think.
Yeah. Absolutely. And actually, an example that is happening right now that I happened this week. Many of you may see in the press that transit agencies, BART, Muni, AC Transit, are fighting to get a $750 million loan from state government to keep them from having to drastically reduce services. You may have heard of the fiscal cliff. Huge advocacy campaign going on amongst transit right now. I've had several people reach out to me to say, transit is important to UC, which it absolutely is. Is UC going to advocate for this? And the answer, unfortunately, is no, and necessarily no. And it's not that it doesn't matter, but it's that UC has our own budget priorities also in front of the governor and the legislature right now. Number one is making sure the governor doesn't cut our own budget. Number two is asking the state to hopefully help us backfill some of the federal cuts to research, Medicare, Medi-Cal, and student aid. Number three, we have existing budget asks in front of the governor to put UC in a bond for housing, as well as a bond for higher education infrastructure. So though we have our own budget asks, and that's why we can't also advocate for a different budget ask that would compete with what we already have. So those are the types of things that I talk to our faculty and leadership all the time. We're the issue, but we have higher priorities that compete with that, and that's why we're not going to play.
Yeah, makes sense. And one other small question is you talked about going with professional societies or community advocacy coalitions. In that case, should we still reach out to you and let you know that we're going to be doing that?
It's always helpful for me to know, especially because sometimes an advocacy group will go and do their own meeting with a legislator, which is great. Sometimes those meetings are very well organized and it's clear exactly who's in the room. Sometimes the advocates are maybe a little less experienced and less organized, and they might say, oh, we have all these UCSF people in the room. And then I get a call from the staff later saying, hey, I just met with UCSF about this policy issue. And I go, really? We're actually not involved in that issue. And it's helpful for me to know, oh, you know what? I actually heard about that meeting. That was actually the American Cancer Society. They just brought some of our oncology faculty with them, but that wasn't UCSF. So just letting me know kind of helps me be better supportive of you and not end up being surprised when I hear about our faculty being in the room.
Yeah, great.
Yeah. Okay.
Uh,
Let's talk quickly about a couple state issues and then we will can take a few additional questions at the end. Thanks for that, Beth. So here's a couple of things that where UC actually has taken a position on state issues this year. So again, the budget. We're a state agency. We are funded in part by state government. State budget is going to be at the top of the list every year. This year, in his January budget, the governor proposed to cut the UC and CSU budgets by 8%. So huge, huge loss to our university. We fought really hard to reverse that cut. And when the governor signed the final budget, On July 1st, we were successful, but that was after a lot of meetings with faculty, chancellors, letter writing campaigns through UC advocates. That is how we succeeded in taking that 8% cut and closing it to zero. We also were successful in gaining a small amount of money to expand the prime program to the School of Dentistry, despite the bad state fiscal situation. So that was a great win for UCSF this year. I mentioned we are trying to get into a bond that would provide state tax credits to help us build faculty, student, and staff housing for UC, including for our campus. There is legislation pending to try to reduce bias in AI technology that's used in healthcare, and our own faculty are consulting on that. We actually sponsored legislation, the University of California did, to prohibit the release of reproductive health research data to any outside organization that might want to use it to then try to reverse engineer who was it that actually got the abortion, so that when women from Texas, for example, come to UCSF, they receive that reproductive health care, and that data is then used in research. The Attorney General of Texas can't subpoena the research data to figure out who got an abortion. That patient's data is going to be protected. Again, legislation to create a California version of NIH, we advocated for that. And then protecting the 340B drug discount program. That's a somewhat technical issue, but it's making sure that UCSF, because we serve a lot of Medi-Cal patients, we are able to purchase pharmaceuticals from pharmaceutical companies at a discount. Pharma is trying to make it harder for us to get that discount, and we're trying to protect it so that we can continue to reinvest that money back into the hospital. So those are some of the state issues that we worked on this year. And I want to end with this slide. Here's some of our UCSF faculty at a rally at City Hall, direct action, calling for the protection of research funding. And I love this poster that they made. We were mad scientists, but now we're furious. They know how important research is. You all know how important research is to clinical care for our patients. It's life-saving. And it's faculty, postdocs, staff, researchers, learners like all of you taking action that elevate these issues to policymakers. So I want to encourage you to heed the call from Nancy Pelosi. Know your voice, know your responsibility, use it, and please come to me and Community and Government Relations to support you and help you be effective in fighting for the work that you do at UCSF. Thank you so much for having me. You can feel free to reach out to me directly for questions, ideas, and you can, of course, reach me through IHPS. And with that, I'm going to stop sharing, and I'm happy to answer any additional questions that folks may have.
Wonderful. Thank you so much. And just a reminder for people to put questions in the chat if you have any questions. I know that your focus is on state and local government relations, but obviously there's a ton that's happening at the federal level.
There is.
And so any words of wisdom or advice or things you can share about what UCSF and UC more broadly are doing at the federal level right now.
Absolutely. Yeah. Thank you for asking that. My focus is state and local. My colleague, Eric Anthony, manages federal government relations for UCSF. He's actually seated in DC and works from there. And it makes, we're so lucky to have him because, as you know, UCSF is the largest public recipient of NIH funds in the country, about $900 billion last year. Under the current president and his administration in DC, we have had over 100 research grants that have been cut or paused. We've been able to restore many of those, but not all of them. It's been very disruptive, to all of us, not only for our research and our patient care, but just, our PIs and research assistants being able to know whether or not they have jobs. So we are working regularly with the other UCs to visit directly with members of Congress and be sure that they understand what is at stake, not only for UC campuses, but for their constituents whose medical care depends on the research that we do right here at UC. Our Vice Chancellor for Research, Hal Collard, and our Chancellor, Sam Hawgood, have traveled back to DC regularly to meet in person with those members. We're not only lobbying members of Congress, we're also working with federal agencies to advocate for regulations and rules that will protect our funding. So on the federal level, it's very, very much a coordinated effort with UC Office of the President and our other campuses. We're not out there going alone. We're coordinated across all of the 10 campuses and the 3 labs at University of California. Um, in addition, we have a training program that specifically selects faculty members and also learners who want to experience direct advocacy in Washington, D.C., where we provide some additional training and organize a trip for you back to D.C. It's called the SHARP program. And you can reach out to me to find some additional information for how that works. So yeah, that advocacy is ongoing. A way that you can participate in that right now is again by signing up for UCSF advocates, because members of the legislature hearing directly from you is one of the most important ways for them to understand what issues they should pay attention to.
Great, wonderful, yes. And I'm just going to invite Dr. Janet Kaufman to join us too, in case she has any questions she wants to add in. As I said, she and I share the role of co-associate director for policy programs.
Sure.
Yeah, thanks, Janet.
I mean, this may be a little beyond your orbit, but I guess am curious in your conversations with folks in state government, where folks see the state budget headed in the next year.
Great question. Thank you for asking that. I wish I had good news. I am often sort of a dark rain cloud when talking about the state budget. We are looking at multi-billion-dollar deficits into the future, certainly next year and probably a year or two beyond. A lot of it is a structural problem with the California budget. And without getting too wonky, something that everybody should understand is that in most states, the budget is tied to property taxes. Values are somewhat stable. They increase gradually over time, and it makes the budget much more predictable. But because we passed Prop 13 back in the 70s and we capped property tax revenue, and it can only grow at a small rate, property tax is a smaller percentage of the budget. A larger percentage of the California budget is tied to income tax. 40% of our budget is tied to the top 1% of earners in California. And that top 1% of earners, their income is tied to the stock market. So as the stock market goes like this, their income goes like this. And so it follows in that the California budget goes like this. And right now we're in one of these. In addition, the state of California is going to be very challenged by HR 1, the president's big, beautiful bill, which is going to severely cut funding from Medi-Cal. Medicaid federally in California, we call it Medi-Cal. That's a huge source of funding for the state of California. That's going to be a challenge. And then Los Angeles County, the largest county in California, they experienced those devastating wildfires last year. LA County doesn't have to pay their property taxes until October. So we actually don't know how much is coming in from LA. We're guessing, but it's going to be less because of those devastating losses. So between those 3 things, those are really creating challenges for the state of California. We are expecting the governor to again propose cutting the UC budget. And so a lot of our advocacy is going to be around trying to stop that. Additional sources of revenue for UC programs, we're going to be looking at things outside of the general fund, like can we capture cap and trade funding to fund climate research? Could we maybe pass a bond to generate new funding for research? Prop 63 is mental health funding. Could we look at how that funding is allocated to be sure it's more focused on our priorities? Those are the kinds of things we'll be doing to try to nip around the edges to generate funding for things we care about. But the state of California is struggling with the state budget right now, I'm sorry to say.
I thank you for that sobering news.
Yeah. I had another question, which is you talked about sort of, there may be times when you can help us figure out, is this a good issue? And oftentimes, like, maybe we've talked with you and actually it is a salient issue, but as you were saying, like for example, transportation, it's a great issue. It's just that UC has a competing priority. In a case
Right.
like that, are you able to help us, get meetings with the right people, that sort of thing? I think that's a question that sometimes comes up.
Yeah, it is. And I would say, if anybody, for example, wants to lobby the legislature or the governor's office on a particular issue, we have academic freedom here at UCSF. Folks can always advocate on their own behalf for whatever they like. They can stake out a policy position on whatever they like, and people can feel free on their own behalf to advocate. On the issue of the transportation funding, because that competes directly with a UC funding priority, that's probably not one where I can be too helpful in helping folks get meetings. But if it's an issue that's an important one, but UC is not going to play and it doesn't really compete with something else we're trying to do, then I'm certainly happy to advise you. I may not set up the meeting for you, but I'm happy to say, here's the process you need to do to get your own meeting, and I can help you navigate how to do that for yourself. Absolutely.
Super helpful. And then I think I've heard you talk before about sort of what's allowed and what's not allowed as a UCSF employee, and just
Yeah,
sort of use of email, use of computer, that sort of thing. So
sure.
I think that might be helpful to re-review that for
Yes.
people.
For sure. Yeah, I'm happy to do that. If you would like to advocate on a policy issue on your own behalf, and it's about a bill as opposed to something that is on a ballot for an election, as long as you're being clear that you are, speaking in your role as a UCSF expert, it's completely fine, honestly, to use your UCSF email or make a photocopy or two on your UCSF copy machine. That's fine. But if it's about an issue that is on the ballot for an election, um, all kinds of restrictions. And the rule of thumb is you cannot use state resources for any political activity. So, for example, next Tuesday, there's going to be a recall election for Supervisor Joel Engardio in San Francisco. Those of you that live in the Sunset District in San Francisco are going to have the ability to vote on whether or not to recall your supervisor. You cannot use your UCSF email, copy machine, room, logo, anything to participate in that election. You on your own can do whatever you want on your own time from your own home with your own Gmail, going to make copies at Kinko's. That's you on your own time, but you can't use UCSF resources for any kind of political activity. We do a lot of conversations around that, usually every even numbered year when we have general bigger elections. This year, there's just two. Joel Engardio recall is next week, and then in November, there'll be a one issue statewide election on redistricting in California. If it's on the ballot, keep it far away from UCSF.
Yeah, perfect. I think oftentimes what's most helpful for that for people is not just the restrictions, but also that when it comes to legislation and policy issues, that actually it is okay to reach out from your UCSF.
Totally fine. And I'll say a common email that I get from faculty all the time is, hey, I've been asked to like sign on to this letter endorsing a bill. Like, is that okay? Common. If you're not sure, ask me. And usually the answer is you on your own as an individual subject matter expert. Absolutely. On behalf of the university, no, you can't. UC is not taking a position on that.
Great.
That's usually the answer.
Wonderful. We are right at the top of the hour almost. So I just want to thank you very much, Ami. Always so wonderful to hear from you and all the great work you're doing. And thank you for your ongoing partnership. And also just want to remind people, as I said at the top of the hour, that we will continue to have monthly webinars and that the registration for our workshop on how to work with journalists, which is on October 23rd from 9 to 12, is open for IHPS affiliates and soon will open to others. So be on the lookout for that and feel free to reach out to any of us if we can be helpful. Thanks,
Great. Thanks
everyone.
to everybody for joining. Dr. Kaufman and Dr. Griffiths, thank you so much for having me.
Thank you so much. And
Thank you
then
so much.
this is
All right.
recorded and will be available afterwards. So thanks so
All right.
much.
Thank you. Bye.
Bye.